I'm Bob Greenspan, and welcome to this podcast that I've entitled The Bleeding of George Washington. Various diseases and medical conditions have always plagued us, so our questions, what caused this and why me, are quickly followed by those ready to jump in with answers. Without the benefit of today's gold standard double-blind studies, desperation has driven patients and providers in all sorts of bizarre directions. Even with the availability of those studies, unfortunately nothing has changed for many. Erasmus Darwin was an 18th century physician and philosopher. He was Charles Darwin's grandfather, and in his 1794 work, Zoonomia, he recognized a common resistance to science.
Ignorance and credulity have ever been companions, and have misled and enslaved mankind. Fictions of fantasy, of witchcraft, hobgoblins, apparitions, vampires, fairies, of the influences of the stars on human actions, miracles wrought by the bones of saints, the flights of ominous birds, the predictions from the bowels of dying animals, expounders of dreams, fortune-tellers, conjurers, modern prophets, necromancy, animal magnetism, metallic tractors, with endless variety of folly.
Unfortunately, even with access to modern scientific evidence, some still adhere to many of Darwin's explanations regarding the causes of disease. From the earliest times, higher powers have been held responsible for illness that was perceived as a punishment for various transgressions. Victims of leprosy and syphilis were the first to be singled out, and the only path to a cure was a religious one through absolution. Following is a 12th century mosaic from the Cathedral of the Assumption in Monreale, Sicily, entitled Jesus Cleans the Leper, accompanied by a passage from Leviticus 26.
If you refuse to obey my laws and commands, and break the covenant I have made with you, I will punish you. I will bring disaster on you, incurable diseases and fevers that will make you blind and cause your life to waste away.
In the 5th century BC, Greek physician Hippocrates of Kos established a unified theory regarding the etiology of various diseases, an approach that subsequently influenced medical care for centuries. In his proposed rules of harmony, he taught that all body systems were naturally balanced and the disease was the result of an interruption in those relationships. Hippocrates referred to the 4 bodily fluids or humors that initially had been described by contemporary Greek philosopher Empedocles in his book On the Nature of Man.
The body of man has in itself blood, phlegm, yellow bile, and black bile. These make up the nature of his body, and through these he feels pain or enjoys health. He enjoys the most perfect health when these elements are duly proportioned to one another. Pain is felt when one of these elements is in defect or excess, or is isolated in the body without being compounded with all the others. For when an element is isolated and stands by itself, not only must the place which it left become diseased, but the place where it stands must, because of the excess, cause pain and distress.
Physicians stress the importance of maintaining a balance between the 4 bodily fluids. Starting at the upper left in this 13th century manuscript are representations of blood, phlegm, yellow bile, and black bile. Someone with excess blood would have a sanguine personality and known for laughter, music, and passion. A phlegmatic person might be sluggish and dull, perhaps characterized by a chronic cough from excess phlegm. A choleric individual would be quick to anger, energetic, and arrogant, while a dark, melancholic individual might have a depressed and gloomy personality. After careful study, early physicians would attempt to correct perceived imbalances in the 4 humors by way of emetics, purgatives, diaphoretics, and bloodletting. If successful, patients would be left in good humor, which is where we got that expression. The number of substances physicians had available to accomplish those goals was very limited. For example, they used cucumber seeds to lower the temperature, which is where we get the expression of being cool as a cucumber. Later in the 19th century, tartar emetic was given to induce emesis, jalap was a popular purgative, and physicians sometimes prescribed toxic doses of calomel, which is mercury, to elicit salivation. As is the case with almost everything we believe, whether scientifically proven or not, There's a grain of truth in what was the most popular form of balancing the humors, that is bloodletting. For example, reducing the intravascular volume can be very helpful in reducing the fluid overload that may accompany heart and kidney failure. Let me give you a true anecdote. After I completed my medical training at the University of Maryland, I took a fellowship in nephrology at The Ohio State University. Late one evening, I was called to the emergency room to see a young girl who had missed her dialysis and was so fluid overloaded that she was about to go into respiratory failure. Since her hematocrit was good and we couldn't get her on dialysis for several hours, I asked the phlebotomist to remove 2 units of blood. The young lady sat up and her breathing immediately improved. When we were able to get her on dialysis several hours later, I was able to give her back her blood as packed cells. When later asked about the event, I responded to the Ohio State House staff with a smile that we usually bleed everyone at the University of Maryland. Without an understanding of physiology, bleeding remained a common form of therapy throughout the 19th century. Bloodletting was practiced as early as in ancient Egypt. This 5th century BC Greek Arabellos shows a physician performing phlebotomy in order to equalize his patient's imbalanced humors. Avicenna was one of the most important and influential 11th century physicians and philosophers in the Muslim world, writing in both Arabic and in Persian. His canon of medicine continued to be studied in European medical schools into the 17th century. These are his thoughts on some of the benefits and risks of bleeding.
Bloodletting is only applicable when the blood is so superabundant that a disease is about to develop or when the disease is already present. Cases include persons on the verge of epilepsy, melancholia, internal inflammatory masses, persons with piles which generally bleed but now do not, women who fail to menstruate. Cases of severe blows or falls need bleeding for fear of an inflammatory mass developing, for there is a risk of causing the latter to burst before it has matured. Syncope rarely occurs during the flow of blood. One only bleeds up to syncope in cases of extensive angina or inflammatory swellings or in cases of severe pain. The first bloodletting may be accompanied by syncope if it is carried out quickly on a person not accustomed to it. Therefore, emesis should be first procured to guard against that, and it may be repeated at the time of bloodletting.
Christian monks in the Middle Ages were prohibited from using surgical instruments, so they asked their visiting barbers to perform any necessary minor surgery, which resulted in a multi-decade competition between British physicians and these so-called barber surgeons. Monks who were sworn to celibacy had read in Latin medical texts about the danger of retenix seminis, or withholding the semen. The problem was that sexual relations and masturbation were felt to be sinful, though celibacy, on the other hand, led to an imbalance of the humors and thus to disease. The perfect solution was bloodletting, since the humors could be balanced while at the same time sexual desires could be quenched. As a result, monks were bled monthly, noting that the monthly menstrual cycle was nature's way of normally cleansing and equilibrating the system in women. Listen to the following verse by a medieval author. Monks were especially interested in the last 2 lines.
By bleeding, to the marrow cometh heat, it maketh clean your brain, relieves your eye, it mends your appetite, restoreth sleep, correcting humours that do waking keep, all inward parts and senses also clearing, it mends the voice, touch, smell, and taste, and hearing to bleed doth cheer the pensive, and remove the raging fires bred by burning love.
Bloodletting was popular for thousands of years and certainly into the 19th century, as evidenced by this daguerreotype. Barber surgeons asked their patients to squeeze a pole during phlebotomy in order to increase the flow of blood. The poles were subsequently stained red, and when not in use, they were hung outside the door with the white linen tourniquet wrapped around. The familiar red and white pole outside of barber shops today remains a vestige of those early bloodletting sessions by barber surgeons. This medieval author vividly described the benefits of a good bloodletting session, making the procedure hard to resist. The quote is accompanied by a 19th century illustration of the procedure by Borgerie in one of his anatomy texts.
Phlebotomy is the beginning of health. It strengthens the mind and memory, purges the bladder, dries out the brain, warms the spinal cord, clears the hearing, restrains tears, relieves anorexia, purifies the stomach, invites digestion, induces sleep, is believed to favor long life, and drives away disease.
Most physicians carried a small case of thumb lancets so they could bleed a patient at any time. This is a display of 19th century lancet cases made of popular materials. From left clockwise, leather, fish skin, ivory, ebony, mother of pearl, tortoiseshell, gold, and silver. Barber surgeons did much of the bleeding, so the classic receptacle for collecting blood was a barber's bowl. Of interest is that the helmet of Mambrino that was worn by Don Quixote was similar to the one you see here on the right. Author Miguel de Cervantes was the son of a surgeon and may have gotten the idea of using a bleeding bowl in his famous character's costume from the time he spent with his father. Joseph Pancoast was an important 19th century American surgeon at the Jefferson Medical College in Philadelphia who wrote a treatise on operative surgery in 1844. Following are his indications for and purposes of bloodletting, accompanied by a hand-colored illustration from his book.
The opening of the superficial vessels for the purpose of extracting blood constitutes one of the most common operations of the practitioner. The principal results which we effect by it are first the diminution of the mass of the blood by which the overloaded capillary or larger vessels of some affected part may be relieved. Second, the modification of the force and frequency of the heart's action. Third, a change in the composition of the blood rendering it less stimulating, the proportion of serum becoming increased after bleeding. Fourth, in consequence the production of syncope for the purpose of effecting a sudden, general relaxation of the system, and fifth, the drawing of the force of the circulation from some of the internal organs towards the open outlet of the superficial vessel. These indications may be fulfilled by opening either a vein or an artery.
British surgeon George James Guthrie was very aggressive in his bloodletting. The following oil by Neveu Mathis illustrates the care some physicians took regarding the effect that bleeding had on their patients' vital signs.
My 16 ounces were increased to 30, but it would not do. It was evident that to succeed no limit should be placed to the abstraction of blood but the decided incapability of bearing its further loss. Every man was therefore bled when he came into the hospital until he fainted, and the bleeding was repeated every 4 hours, or even oftener as long as pain or difficulty of breathing remained.
In his 1743 General System of Surgery, German surgeon Lawrence Heister graphically described risks that awaited patients about to be bled.
The arteries, nerves, and tendons are frequently very nearly seated to the veins. 'Tis no uneasy matter to injure one or other of them with the instrument used in bleeding, which is quickly followed either with a profuse or fatal hemorrhage and aneurysm, violent pains, inflammation, fever, mortification, or even death. Phlebotomy therefore should be performed with no less judgment and caution than the other important operations in surgery. A good phlebotomist should have a steady, nimble and active hand, with a sharp eye and undaunted mind, without which he may either be liable to miss the vein, or commit some accident that may be injurious or fatal to the patient and his own character. For these reasons it is that venesection is less readily practiced by the surgeon as he advances in years, because old age is generally accompanied with a weak eye and a trembling hand.
The word leech is derived from the Old English word lease, which means doctor. Syrian physicians reportedly first used leeches for bleeding as early as 100 BC because this was a painless and efficient way of drawing blood. The leech excretes several hormones, including one to anesthetize the bite, one to dilate vessels to ensure flow, and a third, hirudin, to act as an anticoagulant. Leeches were transported in pewter or silver carriers to be placed on various predetermined areas of the body. They were often directed toward difficult to reach places such as in the mouth, larynx, ear, conjunctiva, rectum, and vagina by way of small glass leech tubes, as seen in the lower example. The ability to use leeches in confined areas made this a preferred form of venesection in many circumstances. In fact, in 1833, British physician Jonathan Osborne suggested passing a thread through the tail of leeches so that they could be used in the anus without being lost. Scottish physician William Buchan described an unusual use for leeches in his 1798 book, Domestic Medicine.
I have been accustomed for some time past to apply leeches to the inflamed testicle, which practice has always been followed with most happy effects.
In his 1865 book, The Practice of Medicine and Surgery Applied to Women, American gynecologist William Heath Byford suggested another unusual placement for his leeches.
A common glass speculum introduced so as to include and isolate the cervix is what I have been in the habit of using. The leeches are thrown down to the bottom of the speculum after the parts are cleaned of mucus, and the leeches are watched until they seize the part.
Leeches needed to be stored and cared for, so there were many different types of leech containers like the ceramic and glass ones seen here. The use of leeches was an important part of the medical armamentarium throughout the 19th century, and nurses played a significant role in their use. In 1892, Dr. Percy Lewis described the duties of the nurse in his book, The Theory and Practice of Nursing.
The part to which they are to be applied is to be well washed first. The leeches are to be handled as little as possible. They are best placed in a wine glass, which is then inverted over the spot where they are wanted to bite. A nurse may be frightened of a leech herself. If so, she should not let the patient notice it, as fright is catching, but familiarity, especially with a leech, breeds contempt. Nurses frequently have great difficulty in knowing which is the head end of the animal. The head is the more pointed end, which a nurse may find out by letting him walk. A leech always moves head first. When replete they drop off of themselves, but should they be tardy in doing so, it is only necessary to sprinkle on them a little salt. A leech must never be pulled off, or their teeth will be left in the wound and the patient will be hurt. After the leeches have dropped off, it is as a rule only necessary to apply a little absorbent wool to stop the bleeding. A very vigilant watch must, however, be kept on the punctures for some hours after, for they sometimes bleed profusely.
The story of the first president's final hours began on December 12, 1799, when George Washington, then 67 years old and 2 years out of office, was exposed to what was described as rain, hail, and snow falling alternatively with a cold wind during a horseback ride on his Mount Vernon estate. The first to arrive was Washington's family physician, Dr. James Craik, who had served with Washington in every major battle of the Revolutionary War. Two other physicians attended the president during the next several hours, Dr. Gustavus Brown from Port Tobacco, Maryland, just across the Potomac River, and Dr. Elisha Dick, a nearby resident of Alexandria. The president's sore throat progressed despite their best efforts, and George Washington died within 24 hours. According to the Times of Alexandria, the cause of death was Senache trachealis, an upper respiratory infection that might have been described today as acute epiglottitis, perhaps caused by Haemophilus influenza. To follow is a statement made regarding the president's final hours made by doctors Craik and Dick. To clarify some of those terms, an ague is a fever, painful deglutition is difficulty swallowing, calomel is mercury used as a laxative and a diuretic, and emetic is a medication to induce vomiting, and a cataplasm of bran was topical heated bran intended to reduce inflammation. George Washington's doctors removed an astonishing 4.5 quarts of blood, which was about a third of his total blood volume, in less than 24 hours.
Sometime in the night of Friday the 13th, having been exposed to rain on the preceding day, General Washington was attacked with an inflammatory affection of the upper part of the windpipe, called in technical language Senache trachealis. The disease commenced with a violent ague, accompanied with some pain in the upper part of the throat. a sense of stricture in the same part, a cough, and a difficult rather than painful deglutition, which was soon succeeded by fever and a quick and laborious respiration. The necessity of bloodletting suggesting itself to the general. He procured a bleeder in the neighborhood, who took from the arm in the night 12 or 14 ounces of blood. He would not by any means be prevailed upon by the family to send for the attending physician till the following morning, who arrived at Mount Vernon at 11 o'clock on Saturday morning. Discovering the case to be highly alarming and foreseeing the fatal tendency of the disease, 2 consulting physicians were immediately sent for. In the interim were employed 2 copious bleedings. A blister was applied to the part affected. 2 moderate doses of calomel were given. An injection was administered which operated on the lower intestines, but all without any perceptible advantage, the respiration becoming still more difficult and distressing. Upon the arrival of the first of the consulting physicians, it was agreed to try the result of another bleeding, when about 32 ounces were drawn, without the smallest apparent alleviation of the disease. Vapors of vinegar and water were frequently inhaled. 10 grains of calomel were given, succeeded by repeated doses of emetic tartar, with no other effect than a copious discharge from the bowels. The powers of life seemed now manifestly yielding to the force of the disorder. Blisters were applied to the extremities together with a cataplasm of bran and vinegar to the throat. Speaking, which was painful from the beginning, now became almost impracticable. Respiration grew more and more contracted and imperfect till half after 11 o'clock on Saturday night, when, retaining the full possession of his intellect, he expired without a struggle.
The care provided to President Washington was controversial, and the youngest of his 3 physicians, Dr. Elisha Dick, had recommended that a tracheotomy be performed. This was not a common procedure at the time, and unfortunately, his perhaps life-saving suggestion was denied by the other 2 physicians. Dr. Gustavus Brown summarized his findings to the medical community.
In their treatment of Washington, his doctors followed the accepted rules laid down by the best authorities of that day. As bleeding was then practiced, the amount of blood withdrawn was not unusual. From the nature of the illness, death was a foregone conclusion. The vigorous therapy resorted to by his physicians may have hastened Washington's death, but it could in no way have caused it.
The practice of bloodletting was remarkably popular for many centuries and in many civilizations. So how was that possible when today it seems to have been such a barbaric and harmful procedure? I will actually be going to spend an entire podcast on what pseudoscience is and how it works, but briefly, there are some circumstances in which phlebotomy can be therapeutic, and in fact, I gave you one example when I successfully bled my dialysis patient. Mid-19th century medical discoveries allowed us to more accurately determine the cause of some diseases, but before that, there were many explanations, including astrological forces, like this early representation you see here, dated 1416, entitled The Anatomical Man by the Limborg brothers. Others included punishments for religious transgressions, the curses of enemies, evil spirits, miasma or bad air, and imbalances in our bodily fluids that for correction required bloodletting, emetics, purgatives, diuretics, blisters, and other bizarre medical treatments of all sorts. Thanks for joining me, and I hope to see you next time in a trip to meet some folks in the past of medical history.